Hello friends, today I'll be talking to you about high uric acid. So many of you would have heard that high uric acid is dangerous to the body, or if you have a blood work done and that's showing high uric acid, what is the importance of that and what can be done to reduce the uric acid. So let me come to it one by one. So what is the threat due to a high uric acid in the body? So uric acid is basically a waste product in the body. It is basically a very weak acid. In the concentration that is present in the blood, it is almost at supersaturation. Okay, so normal levels of uric acid in the body are below 6 milligram per deciliter. So if you have a value above 7 milligram per deciliter, the uric acid can precipitate in colder areas of the body. Usually the blood is warm, it is at 37 degrees, but in colder areas like your foot or in the knee, they can precipitate and cause a sudden arthritis called gout. So let us look at what proportion of people have high uric acid in the population. So if you look at both men and women, approximately around 20% or 21% of the general population will have a high uric acid. And what are the risk factors for high uric acid? One is excess purine intake. So purine can be in the form of red meat or alcohol, especially beer, not wine. Beer contains more of purines, and spirits also will increase the risk of gout or increase the risk of high uric acid in the body. Another risk factor is medication. So many of us will be taking medication for high blood pressure. If we take a chlorthalidone or a hydrochlorothiazide, it's a high risk factor for high uric acid. And there are certain other medications also which can increase the uric acid level in the body. This is the number 1 and 2 risk factor. Apart from that, the more prevalent but less strong risk factor is actually obesity and insulin resistance. If you are very obese if you have insulin resistance, that increases your risk of getting a high uric acid level in the body. This is because the high insulin level and the insulin resistance reduce the excretion of uric acid through the kidney. So in the body, the uric acid is excreted 30% through the intestine and 70% through the kidney. And when it is excreted through the kidney, if you have a insulin resistance, the body reabsorbs the uric acid very tightly, therefore elevating the level of uric acid. So therefore, this is the way in which the uric acid levels are high in the body. What is the problem if the uric acid level is high in the body? Majority of people with high uric acid will not have any problems. If you have no symptoms whatsoever and you've done a general checkup, and you see that the uric acid levels are high in your blood test, you don't need to worry more about it. So you can discuss it with your doctor, who will help assess whether treatment is needed for your underlying condition. For example, if you're taking certain medications that increase uric acid, you can definitely, and you can change the medication, you should definitely go for changing of the medication. If you are on various diets which are high in purine, you can change your diet a little bit. If you're overweight or obese, reducing weight will help you reduce uric acid. So what are the threats associated with uric acid? So we have seen how common high uric acid is extremely common, but gout or inflammation of the joint due to high uric acid occurs in only a small proportion of these patients who have high uric acid. So gout occurs in only 3% of the population. So namely, out of 7 people with high uric acid, only 1 person gets a gout attack. So consequently, we don't need to offer treatment to everybody who has high uric acid. So very often, I see patients who are taking a medicine for high uric acid without having any symptoms of gout. So they do not have any gout or joint inflammation. So that is why they are taking the medication. All right. This can be easily avoided. The medication can be easily avoided if the person is taking medication to reduce the uric acid when they don't really need it. So you really need to discuss with your physician whether you really need medication to reduce the high uric acid level. But once you have an attack of gout, it can be a very painful condition, and in order to prevent further attacks of gout, people do take the uric acid lowering drug. So this is mainly only 2 of them are there. One is allopurinol and another one is febuxostat. Both of them are fairly effective in reducing uric acid and consequently the attacks of gout. So also high uric acid level in the body can cause kidney stones. So kidney stones form due to a slightly different mechanism, and the treatment for that is slightly different, because once you have uric acid stones forming in the kidney, so the uric acid stones form in the kidney because the urine becomes very acidic. almost all of us will have very high uric acid levels in urine, because uric acid is actually excreted in urine, and urine will be enriched in uric acid at all times. So the only people who get uric acid stones are those who are having a very acidic environment in the bladder and in the urinary tract. So if you have a very acid urine, you tend to form uric acid stones, and if you form uric acid stones, the best way to treat it is to alkalinize the urine. So one way to alkalinize the urine is a home remedy is basically taking a cup of orange juice every day, say 150 ml of orange juice daily. You can even dilute it and have it. You don't need to take the sugary component. Even if it is a slightly bitter orange juice or a slightly sour orange juice, it's okay. So that it is not very sweet, and you don't need to increase your sugar content in your diet. So likewise, you can consume plenty of water, which will again reduce the acidity of the urine. So like this, the treatment for uric acid stone is different from that of gout. Gout is treated by giving a uric acid lowering therapy. Uric acid stones are actually treated by alkalinizing the urine, which is acidic. So thank you.